When was the last time you were here at the doctor's office? Making regular trips to the doctor, and not just when you're sick, is an important part of staying healthy. With us today to talk about our annual well visits and what to do if you don't have a primary care doctor is Richard Morrow, a nurse practitioner with LeBauer Healthcare at Summerfield Village. All right, so first off, let's talk about this, because sometimes, you know, medical people, healthcare people, they use things interchangeably, and we don't know if they're the same or not. Is an annual wellness visit the same thing as a physical?
So by and large, yes, for most of our population, we do make the distinction with our Medicare patients. The Medicare annual wellness visit will have its own distinct set of requirements, but by and large, if you're making it in for an annual visit to see myself, your own primary care provider, or maybe a primary care provider you've yet to meet, yeah, we want to see you at least once each year.
Okay. All right. So let's talk about this. Who needs to get an annual wellness check? Are we talking about children, adults, both?
In short, everyone. You know, it's important. A lot of these wellness visits are looking to discover these things that we might not know about yet. They're looking for that early intervention and prevention.
All right. So it's not just for those 65 and older, like you heard him say about the Medicare benefits. How important are annual wellness visits?
They're crucial. They're a lot of the foundation of the decisions we make for the rest of the year. You know, I know you'd mentioned a lot of folks want to come in and see me when they're sick, and
Yep.
that's all well and good, but I'd prefer to see you even less frequently. If we can take further steps to make sure you're getting sick less often, I want to take every step we can to make sure that's the case.
Okay. So this is what we hear all the time. Like when we bring this up, I feel fine. I don't need to go to the doctor. What do you tell them?
That's the exact point, is I want to see you for these regular physicals when you are feeling fine. I don't want to work on existing issues. I want to dig up new problems. I want to find new things that we need to worry about, or hopefully make sure we have nothing more to worry about. Those are the times when you're feeling fine is the best time to come in for your routine physical.
All right, let's get some examples here, right? Because people want to know, all right, like, so what? Can you give me some examples of what maybe people have learned during these visits that maybe was surprising?
Right, right. So a lot of insurance companies will make it a requirement or at least provide some incentives for patients to get their annual physicals done. I see some of these patients who say, I feel fine, but my insurance company needs me to be here. My employer asked me to be here. And well, when you know it, maybe their blood pressure's been a little bit high, and we know that blood pressure, you don't feel your blood pressure if it's just a little bit high, but your kidneys feel it, your heart feels it, your organs feel it, and we unfortunately, you know, every now and then we'll catch a case of early kidney disease, and maybe this is a case where we can put off dialysis for years if we intervene in this situation in somebody's 30s or 40s rather than waiting until their 60s or 70s.
Okay. Now, why are the recommended yearly, even for someone who might be, I mean, really just young and healthy? You're talking about, you know, those early 20s, early 30s, and they're like, meh.
Yeah, unfortunately, when it comes down to the things like high blood pressure, high cholesterol, oftentimes thyroid disorders or autoimmune processes, these are things that start to rear their head in their 20s. This early intervention oftentimes prevents later complications, and we can also do more with lifestyle interventions to prevent these changes from taking any real consequence on the body. So if we really can buckle down and making sure we're sort of fine tuning your diet, your exercise, your relationship with health early on, that's less often you have to spend with me later on.
Right. And sometimes we have all of those questions that we'd like to ask a doctor, but we're not in the wellness visit. So that would be a really good time to get them all out. All right. We're going to take a quick break. We're going to come back and we're going to continue to talk about annual visits and some other points to be made about that as well. Richard Morrow, a nurse practitioner with LeBauer Healthcare at Summerfield Village, is here talking about the importance of annual wellness visits. All right, so we've talked about how important they are. Let's talk about what happens, because maybe, you know, things have changed over the last few years if we've been missing our appointments. What's included in an annual wellness visit?
Right. And normally, I'm really hoping not a lot to update on your medical history front, but in case anything's gone on, we need to make sure your chart's updated. In case any family medical history has arisen that may impact your health, we want to update that, update immunizations, and of course, a head-to-toe physical exam and some of that routine blood work that everybody enjoys so much.
Like cholesterol and things of that nature.
Of course, yep.
Of course.
Cholesterol, thyroid check, blood counts, a little bit of everything.
A little bit of everything. All right. So what about this? Because a lot of women go to their OBGYN for their yearly appointment and they use that as their annual wellness visit. Do they need to really schedule both visits?
It's definitely recommended that you maintain care with a primary care provider, and certainly for women who want to maintain the care with the OBGYN, I think that's very important. One does not supersede the other, but of course the OBGYN is going to be more focused on the women's health aspects. Meanwhile, primary care is going to care more about things like your blood pressure and your cholesterol and some of the things that kind of fall out of the scope of that women's health specialty.
Okay, so when we talk about the annual wellness checks, we talked about that for adults. What about for children? How does that differentiate?
Very important for children. And oftentimes for children, we're looking into things like immunizations, making sure the kiddos are safe to go out to school or summer camp, making sure they're fit to play in sports, and of course, looking at some of those developmental milestones, just making sure that kids are growing up healthy and strong.
And is a sports physical the same thing as a wellness visit?
Oftentimes there's enough overlap we can get away with it, but particularly for some of those high school athletes participating at a higher level, we want to have a dedicated sports physical to make sure that their heart's strong and make sure their joints are healthy.
Okay, you know, and for a long time, people were having a hard time finding a primary care provider, right? So if someone doesn't have a primary care provider, then where would they go for an annual wellness visit?
I've got a very easy answer for you there, conehealth.com/appointments. You'll be able to be connected with all of our available primary care providers who are taking new patients, myself included, and be able to even book online for a lot of our providers. It's as simple as that.
Okay, that's good to know, because for a while there you would call and try and get an appointment. They'd be like, everybody's booked and nobody's taking new patients. So this is a good news. All right, if you have a primary care provider, but you haven't been in a few years, should you start and with a call to them or start something new?
Yeah, give the office a call, see about making an appointment when you can. You know, oftentimes, unfortunately, we stay busy in primary care and these physical exams book out a couple of weeks, maybe even a month or two. And so there's no time like the present to give that office a call and get in to see your primary care provider.
All right, I've become a real fan of telehealth. So can the annual wellness visits be done virtually?
So for our Medicare patients, the annual wellness visit still is being accepted as a virtual visit. I think this is very important as we've talked about the spread of COVID, and it still has a presence in our community even after these few years have gone by. These Medicare patients can be seen virtually for that annual wellness visit. However, for most folks, we want you back in the office for a hands-on physical. There's unfortunately no way that I can listen to your heart through the screen. There's no way that I can get blood work from afar.
All right, and what about like the cost of a wellness check? Does something determine it more than something else?
So typically for these preventative visits, insurance really likes to see these done. These are typically visits that are covered by insurance. Of course, your individual plan may vary, but typically, insurance's logic is that if we can do everything we can to keep you from getting sick, well, hey, they're happy to cover those visits.
Okay, now what about, does your annual visit, I'm sure that you're going to tell me, it doesn't take the place of like things like mammograms or colonoscopies or things of that nature?
No, it certainly doesn't. And of course, here in a primary care office, we have limits on what we can do. But I always tell my patients, it's not your job to worry about when you do for your next mammogram. When's your next pap smear due? When was your last colonoscopy? That's my job to worry about that. And if you make sure you're coming to see me on a regular basis, I can make sure that we're looking out for your health.
And schedule all those screenings that we need to have.
Exactly. We get all of that coordinated. And usually I tell my patients, all you got to do is just answer the call and schedule when the office calls.
Yeah, and that
That's
my
about
chart
it.
is fantastic. Makes it
Oh
so
my
easy.
goodness, it's great. It's great.
All right, thank you so much for your time and your expertise. Folks at home, if you missed any of today's segment, just head over to our website, click in the To Your Wellbeing section.